Good afternoon. My name is Dr. Minsoo Choo, and I am the director of the Seoul Urology Clinic. It is an honor to have the opportunity to address you today on the topic of current and future treatments for benign prostatic hyperplasia, with a particular focus on the HoLEP procedure. I will discuss its current status, areas for improvement, and its potential trajectory moving forward. This marks my first time attending the Korean Society of Focal Therapy, and I must commend the organizers on the exceptional program and the high caliber of lectures. I look forward to participating more actively in this esteemed society in the future. In 2013, Dr. Gilling predicted that HoLEP would become the gold standard for BPH treatment. Recently, I had the privilege of discussing this with him during an online conference, where I couldn't help but notice his resemblance to the coach of the South Korean national soccer team, a lighthearted observation that added a memorable touch to our discussion. A decade later, it is time to assess whether his prediction has come true by examining the current status and future potential of HoLEP, supported by data. One valuable resource for understanding the advancements in HoLEP is the SNUH-BPH database, one of the most extensive prostate-related datasets available. A follow-up study published earlier this year analyzed 3,000 cases, yielding highly promising results. The study revealed that about 5% of patients experienced temporary de novo urinary incontinence at 3 months post-surgery, decreasing to less than 1% by 6 months. This highlights the importance of informing patients about the possibility of temporary urinary incontinence. Another remarkable aspect of the study was the patient satisfaction survey. Results showed that 92% of patients expressed satisfaction with the surgical outcomes, and 85% indicated they would definitely recommend the procedure to others. Such high satisfaction rates reflect the procedure's efficacy and positive impact on patient quality of life. Meta-analyses comparing HoLEP and TURP provide valuable insights, showing that both procedures achieve comparable functional outcomes with no significant differences in urinary flow rates, post-void residuals, or symptom improvements. However, HoLEP demonstrated a clear advantage in resection volumes, particularly in patients with larger prostates exceeding 80 grams. This higher resection volume is clinically significant, as it can lead to a more thorough removal of obstructive tissue, potentially reducing the likelihood of requiring additional surgical interventions for long-term outcomes. Despite these advantages, the EAU guidelines currently continue to recommend TURP as the gold standard procedure. However, HoLEP is increasingly recognized as an excellent alternative, especially for experienced surgeons. Similarly, in the United States, TURP remains the primary recommendation, while HoLEP is acknowledged as a viable option for specialists. Thus, it appears that HoLEP has not yet achieved full recognition as the gold standard treatment. In South Korea, the number of HoLEP surgeries has surpassed TURP procedures as of 2023. However, it is worth noting that the majority of these surgeries are performed in general hospitals, with only approximately 15% taking place in smaller clinics. Additionally, the geographical distribution of HoLEP procedures remains concentrated in Seoul and its metropolitan area, highlighting the need for wider adoption across the country. Internationally, particularly in the United States, HoLEP is gaining traction as a viable option, though it still accounts for less than 10% of all prostate surgeries. Here is where HoLEP stands today.